Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
One of the most common problems for women as they age is gaining weight. Tracy, you better read this.
Tread carefully. Tread very lightly here, Dr. Shives.
I didn't say that.
All right. One of the most common problems for women as they age is gaining weight. On average, women in their 50s and 60s gain 1.5 pounds per year. Hot flashes, sleep disturbances, and mood changes can disrupt an otherwise healthy lifestyle.
A recent study at Mayo Clinic, published last month in Mayo Clinic Proceedings, looked at the risks and the challenges of weight gain for women in midlife, and that led researchers to develop a series of recommendations. Here to talk about it is Mayo Clinic endocrinologist, in lay terms she's a hormone doctor, and lead author of the study, Dr. Ekta Kapoor. Dr. Kapoor, welcome to the program.
Thank you. Glad to be here.
I've never been more interested in an interview in my entire life.
It won't happen to you, Tracy.
Oh, well, tell us about the study. First of all, how many women did you study?
So this is actually a review of the current literature, whatever we have out there on weight gain, the pathophysiology, meaning what are the causes, what are the unique influences that cause midlife women to gain weight. And when I say midlife women, I really mean women who are in their 40s and 50s, so 40 to 60 years age group. So what is it that causes them to gain weight beyond what happens in the general population, and what effective strategies and unique strategies we should have in place to manage these women. So that's kind of what triggered. So we essentially reviewed all the literature that's out there and laid out some recommendations.
Were you talking, did you look at women once they reached menopause, or women in the few years before, or perimenopausal, and define those terms for us, perimenopause?
Sure. So perimenopause is the few years that lead up to menopause. And menopause, in a sense, is defined after the fact, because it is once a woman has had her last menstrual period, that then she's in menopause. But there is no way of knowing it when the woman is having the last period that this is the last one. So you always define it after the fact. So when a woman has gone 1 year after having her last menstrual period, she's said to be in menopause. So the few years, and that can be very variable, that lead up to menopause are defined as perimenopausal years. So the way we define it in our clinical world, when a woman starts having menstrual irregularity, so more often in their late 40s, although some women start experiencing it earlier, but that's kind of the perimenopausal period. And that's oftentimes the period when women have a lot of symptoms of menopause, so the hot flashes,
Et cetera.
Yeah.
I'm trying to just have a straight face through this whole thing. I want to sit back and go, preach it, sister. Yeah. The perimenopausal part, it sounds like a wonderful time, doesn't it? It's just a joyful, it's terrible. It's terrible.
It is.
There are so many things, like you mentioned, the hot flashes, the emotional issues that go along with it. There's a lot of different issues. But this study was specifically about weight gain. Why do women gain weight when they're going through perimenopause and into menopause?
Sure. So, as we've said in detail in the article, that all of us, regardless of sex, are predisposed to weight gain as we age. And that has to do with hormonal changes, and that impact our muscle mass and how we use up the energy. But women in particular are exposed to these unique influences as they're going through menopause, some of which you pointed out, Tracy. So having hot flashes, not sleeping well at night, having mood problems. I mean, who wouldn't be thrown off gear and off track and not able to adhere to healthy lifestyle measures?
The only solution for that, Dr. Shives, is Cheetos. Did you know that? The only solution.
Yeah.
There you go, because food is a known comfort measure. And if you can't find comfort and solace anywhere else, many people will resort to eating.
Many people.
And they don't want to exercise. And
that's right.
So it's not just eating more and exercising less. There's something else going on?
Oh, absolutely. So these are physiological changes. So, as we age, we lose muscle mass, and the declining estrogen levels after menopause also contribute somewhat to that. Also, as we are aging, we're losing the male or the levels of the male hormone testosterone, which we...
Well, no wonder you guys are having such a problem.
So even those levels are going down. So we lose muscle mass. So our body is burning fewer calories. So the rules of the game change. So a lot of women will come in our offices and say, hey, doc, I haven't changed a thing. I'm eating the same way, I'm exercising the same amount, and I'm gaining weight. Well, the answer to such women is that if you don't change anything, you will gain weight, because you have to take that extra step to be able to maintain your weight as you enter these midlife years.
You got to kick up your game.
Yep.
And
Pretty
now
much.
we have been very kind because we've just been talking about weight gain. And our producer, Jen, in our scripts here, she calls it midsection weight gain.
I know.
That's very kind. It's hard. She left the room because she doesn't even want to be here for this.
Define midsection
Well,
for
this
us.
is my question. Why is it that when you go through perimenopause and menopause, why is it that the weight gain is concentrated in your pot belly?
Exactly. See, that is the most devastating part to women, not only from a cosmetic standpoint, but from a health standpoint also. So by midsection, it means that women are depositing all that extra fat they're gaining, preferentially in the abdominal area. So it's in the fat that's right under your skin, plus around your internal organs. And that is a direct effect of lack of estrogen, because estrogen affects how your body metabolizes fat and where fat is stored.
What are the risks of having excess belly fat? I've been hearing for the truck driving men and the you don't want to have pot bellies, gentlemen. But what are the risks of that?
Oh, there are tremendous risks to having more fat in the abdominal area. So, having high blood pressure, which again, women in the postmenopausal years are more predisposed to having high blood sugar. Heart disease, which is number one killer of postmenopausal women. As you know, women before they hit menopause, the risk of heart disease is pretty low, and then it just skyrockets after menopause. And a lot of it has to do with this abdominal obesity. Then risk of certain cancers is higher if you have more abdominal obesity. And not to mention the cosmetic concern, but lots of health-related concerns because of increased abdominal obesity.
Yeah, just in case you're wondering, I am not pregnant, Dr. Shives. Not pregnant, just a pot belly.
Yeah. Well, I know it happens, but I'm sure we'll learn from Dr. Kapoor ways to stop that. But let me just review again the health risks, aside from you women think it's cosmetically displeasing sometimes, and men, of course, would never say
never.
that. But you said increased risk of high blood pressure, heart disease, and elevated blood sugar, which translates into diabetes, and certain cancers. You increased your risk of certain cancers if you become more obese as you get older.
Exactly.
So all of those things.
Exactly.
All right, so we want to know, how do you prevent that weight gain as you go through menopause?
Exactly. I wish I had a magic solution there, but ultimately it just boils down to positive lifestyle changes. So the way I look at it, once women receive education about it, in our practice, and they learn that this is something almost to be expected, and one has to be proactive in order to prevent it, and not just doing what they've been doing in their younger years. And the statement that I use oftentimes is that the rules of the game have changed. So just like you said, Tracy, you just have to play harder, play a little different. So women who enter menopause exercising more are more likely to maintain their weight as they go through menopause. So that psychological support, telling them that they have to adhere to healthier eating habits and such. So it ultimately boils down to lifestyle. Yes, there are other ancillary support measures, including medications and such, but really the core ingredient is positive lifestyle changes.
Doesn't Mayo Clinic have a book coming out, a new book on menopause?
It's already out, actually.
Oh, it is? Okay, and what's it called?
It's called the Mayo Clinic Menopause Book.
All right.
As
And
simple as that.
have you reviewed it? Do you like it?
I've contributed
you,
to the...
you're part of it?
I was part of it.
Okay.
Yeah.
So for a woman who doesn't necessarily want to sit down and talk about this with her physician, this is a good book? This is a place to go?
It's a comprehensive review of what to expect and what to do about things.
There's a chapter for each menopausal issue.
You've seen it?
I've got my own copy.
There you go.
All right, we're talking about menopause and all that can potentially go wrong, or all the difficulties, all the issues that may come up with menopause with Dr. Ekta Kapoor. Time for a short break. When we come back, we'll be talking about more menopausal issues, including hot flashes, hormone replacement therapy, and osteoporosis. Plus, we got a myth or matter of fact.
Yes, myth or matter of fact, the average age of menopause in America is 55 years old. We'll find out. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Our guest is an expert on menopause. Her name is Dr. Ekta Kapoor, and she's recently completed a study on problems of menopause with particular emphasis on the weight gain that some women experience as they get a little bit older, and it happens to come right around the middle. And we've heard how we can solve that problem, but it requires lifestyle changes.
Yeah, the main thing is we just got to up our game.
Yeah, up your game. All right, myth or matter of fact?
The average age of menopause in America is 55 years old. Dr. Kapoor, is that a myth or is that a fact?
You're close, Tracy. I can kind of give it to you. The range is really 45 to 55, but the average age in this continent really is 51 years.
But that doesn't take into account the perimenopause.
No.
So when does that start?
So like I said, that this is the few years that lead up to menopause, and perimenopause duration can be extremely variable. It can be 1 year, it can be 7, 8. So there is no average there, but it can last several years painfully. So
yeah, it can be a long time, Dr. Shives.
Let's talk about some of the other issues, and one I want to ask you about is hot flashes. Why do they happen, and what can women do about them?
So that's $1 million question and a very loaded one, Dr. Shives.
I should have let Tracy ask that one.
I think this whole interview is loaded. You're doing a great job, Dr. Shives.
So
I'll just listen.
When it comes to hot flashes, we think it's because of dysregulation of the temperature regulation system, very simply stated. But what exactly does it? We do not really know. It's due to some neurotransmitter changes in the higher brain centers. Science is just sort of unraveling now what a hot flash really means. Up until now, we just thought it was one of those nuisance symptoms of menopause that you either had to treat or you had to put up with. But new research now suggests that it has deeper connotations, and it may have potentially different connotations for women who've just been through menopause versus women who are far into menopause and are older in their 60s and 70s. So to give you an example, we're now thinking that it is a marker of more widespread dysregulation in the body and maybe a marker of heart disease, for example. So women who have worse hot flashes probably are at a higher risk for heart disease, and therefore call for aggressive management of these symptoms. So definitely not something a woman is supposed to put up with. They have to be very aggressively managed. But I just want you to say that stay tuned. The research is just coming out now to tell us what a hot flash can mean in addition to just being a symptom of menopause.
Well, then it's weird because it comes and goes.
Exactly.
I can have hot flashes for a few weeks and then go half a year without it.
Right. And part of it, Tracy, is because of lifestyle triggers also. The big ones really there are smoking, alcohol. Stress is another big one. And go figure, how do you control your stress level, right? But that can be a big trigger for hot flashes.
So how do you treat them?
You talked about managing hot flashes, and so how do you do it?
The most effective treatment out there for managing hot flashes is estrogen therapy. Now, with the big Women's Health Initiative study that came out in the early 2000s, hormone therapy was pretty much banished. But again, now based on current research, we seem to have come a full circle, and there seems to be pretty uniform agreement among experts that estrogen therapy given to younger women who have just been through menopause, so they're in their 50s or within 10 years of menopause, not only does it effectively treat hot flashes, but in fact it's a preventive strategy. And what all does it prevent? It prevents women from dying, it prevents heart disease, it prevents osteoporosis. So there is a good reason to be putting women on hormone therapy when they are recently menopausal. So in my practice, I look at reasons why a woman could not be on estrogen. So the default is to put her on estrogen as opposed to vice versa.
Oh, no, wait, just 1 second. I got to ask you a question. I thought that we abandoned the use of hormone replacement therapy because it increased a woman's risk of heart disease.
See, that's the thing. That's the irony there. Those data were a little bit skewed in the sense, Dr. Shives, the average age of the woman in that trial was 63 years. Now, when do we ever put a woman who's 63 years old, when do we ever start her on hormone therapy? The typical patient that gets started on hormone therapy is a woman in her late 40s or early 50s when she's having most symptoms. So we made the mistake of extrapolating the results of that one single study, which wasn't designed to answer this question. So yes, if you start a woman on hormone therapy, if she's in her 60s or 70s, her risk of heart disease does go up. But for the young woman, it actually prevents heart attacks. And that's a fact that's not publicized enough.
Wow, no kidding. I mean, that's
Good
a
thing that you
complete
do
180.
this. It's a good thing you do this show, Dr. Shives. Why is osteoporosis a concern during menopause?
Let me just follow up
sorry.
1 second. But you are actually talking about lower dose hormone replacement therapy for a shorter period of time, right?
Not
Not necessarily?
Not necessary. That too is changing. So previously the recommendation was once a woman turns 60 or 65, hormone therapy needs to stop. The latest position statements from expert societies now say that it's a matter of weighing risk versus benefit, and you are not to use an age as a cutoff for stopping hormone therapy.
This is why we have to broadcast this show from the Women's Health Clinic.
I know.
It's always changing.
We've almost come full
No,
circle.
exactly.
It's very
That's
confusing.
exactly right.
Yeah.
We have come full circle.
Why is osteoporosis a concern during menopause?
So, estrogen is important for maintaining bone health. So once a woman enters menopause, in those initial 1 to 2 years, women can lose as much as 10% of their bone density. Now, that is huge. And then thereafter, unless they're on some kind of a treatment to prevent those losses, they can continue to lose 1 to 2% every year. And that's huge. It predisposes them to fractures. And as you know, hip fractures are serious. They take lives, right? So osteoporosis management is a serious business.
We have a question here from a listener named Stacy who wants to know what is happening to my sex drive.
Oh yeah,
Let's find that out for Stacy.
That's another loaded question right there.
Well, Stacy wants to know, so go right ahead.
So there are a lot of determinants that influence a woman's sex drive as she's going through menopause. So the biggest influence, as I see it, are the changes of aging. A few minutes ago, I shared with you that we make the male hormone testosterone in much lower amounts than the men make it, but that is supposed to have a permissive effect on sexual function. So as we are aging, our testosterone levels for women, as for men too, are going down. That's one. Then the changes of menopause, all these symptoms for a woman who's tired, not sleeping well, having mood problems, you can imagine what happens to their sexual function. Plus changes of vaginal dryness and the pain with intercourse. So you can imagine all these influences are pretty much brakes on a woman's sex drive. So there is nothing on the gas pedal, everything on the brake pedal. And throw on top of it things like relationship conflict and such. When you've been in a marriage for these many years, there are issues that come up, right?
I'll make sure to let her know that. Are there any supplements that help women with menopausal symptoms?
Not consistently. So for one, we don't have strong data regarding their effectiveness, plus toxicity is always a concern with supplements. So no. And my point being that when we have an effective medicine out there, which has several other additional benefits, every reason to put women on estrogen, then deprive them of it.
Well, it's interesting. You talked about the benefits of hormone replacement therapy and how much that's changed. Your recommendations have changed, but you said it could help control hot flashes. It could help prevent heart disease. It could help prevent osteoporosis. Does it do anything for libido? What Stacy wants to know.
Yeah, thanks.
It can potentially improve libido, specifically for women who are having a lot of menopausal symptoms by making them better. But I can say that for a woman who's not having any menopausal symptoms, estrogen per se has a huge impact on libido.
All right. Well, you are a wealth of information. For your first time on the program, you were fabulous. Dr. Ekta Kapoor, thanks so much for being with us.
Thank you.
We've been talking about the health challenges faced by women as they age with an endocrinologist from the Mayo Clinic. Dr. Kapoor, thanks again for being with us.
Thank you. Pleasure.